You're alone in the bathroom, and you look down at something that doesn't quite look like it usually does. Maybe it's darker, maybe it's a different shade entirely. And in that moment, you're standing there wondering, is that normal? Should I be worried? Will it go away on its own? Then you flush it, you hear it go, and you walk out of that bathroom carrying a question you don't quite know how to answer. Here's what I find fascinating. Almost nobody looks at their urine deliberately. Almost nobody knows what they're actually looking at. And almost nobody realizes that what you see in that bowl is literally a window into what's happening inside your bloodstream right now. By the end of this video, you're going to know exactly which colors are harmless, which ones demand an appointment with your doctor, and most importantly, you're going to know the difference between something you can safely flush away and something you genuinely cannot ignore. Before we go further, if you've ever stood in that bathroom and wondered exactly what I just described, subscribe to The Healthy Habit right now, because everything we make here is built for that exact moment, when you notice something about your body and you need a straight answer from someone who actually knows. I'm Dr. Gerald Mark, and I've spent a lot of time looking at urine, far more time than most people would consider normal. And what I've learned is that your urine is telling you a story about your kidneys, your hydration, and sometimes about problems that are hiding without making you feel sick at all. Here's what most people over 60 don't realize. Your kidneys are filtering roughly 180 liters of fluid from your bloodstream every single day. That's enormous work. And what comes out the other end is a messenger. It's telling you whether your kidneys are handling that load well, or whether something is starting to strain. I had a patient, I'll call him Calvin, who almost didn't come in at all. His wife had to essentially make the appointment for him. He sat down in my office, looking embarrassed, like a man convinced he was wasting my time. But what happened to Calvin is exactly why this video exists. Your urine is essentially filtered blood. Your kidneys pull water and waste out of your bloodstream constantly. The color comes from urochrome, a pigment produced when red blood cells break down. You produce roughly the same amount every day. What changes is the amount of water running through. Think of it like adding drops of food coloring to a glass of water. A full glass with the same drops stays pale. A few tablespoons of water with the same drops turns dark. The coloring stays constant. Only the water changes. That's why less water makes darker urine, and more water makes paler urine. But here's what matters. The signal comes before the symptom. Your urine changes color before you feel pain or sickness, which means the moment you notice something different is the moment your body is trying to help you. Most people flush that moment away. You're not going to do that anymore. Calvin was 56, retired, active with his wife. He felt good. One morning he noticed his urine looked pink, just slightly off. He decided it was probably dehydration or something he ate, so he didn't think much about it. 3 days passed. It didn't change. That's when his wife made him call the doctor. He came in feeling embarrassed. He felt completely fine. No pain, no urgency, just that color change. He was checking his phone while I reviewed the results, fully convinced this was a nothing appointment his wife had dragged him to. I did a urinalysis. We found blood in his urine. When I looked up and told him what I'd found, he put his phone down very slowly. That's the moment I remember most. Not the diagnosis, but the phone going down. It turned out Calvin had an early-stage bladder tumor. Because he came in when he noticed the color change, with no other symptoms, we caught it early. The treatment was straightforward. He's doing well now. But if he'd flushed it away and waited, his story would be completely different. Calvin's wife saved his life by making him act on one small observation. This one fools people the most because it looks dramatic, but is often harmless, until it isn't. Cloudy urine by itself, especially first thing in the morning, can just be concentrated urine. But cloudy urine, plus burning when you urinate, plus frequency, plus lower belly discomfort, that's a urinary tract infection. That's a same-day doctor call, especially in men, because UTIs in men are rare and should never be ignored. I had a male patient who dismissed cloudy urine for 2 weeks, assuming dehydration. By the time he came in, the infection had moved to his kidneys. He had pyelonephritis, a kidney infection that could have been treated with antibiotics 2 weeks earlier. Now he was dealing with something much more serious. Think of your urinary tract like a pipeline. Ignore blockage at the beginning, and it moves downstream, causing problems you can't see. The lesson, cloudy plus symptoms, means call the doctor today, not tomorrow, today. This color catches people who think they're being healthy completely off guard. After extreme exercise, especially a big jump from your normal level, you can see very dark brown urine that looks cola-colored. Usually it's dehydration, but it can also be rhabdomyolysis, where muscle cells break down during intense exertion and release myoglobin into your urine. When muscles work beyond what they're trained for, they can literally break apart at the cellular level. That breakdown releases contents into your bloodstream that your kidneys filter out, creating that dark color. This isn't common, but it's not rare either. If you see this after pushing yourself hard, drink a lot of water. Reassess. If it improves over the next day or so, you're fine. But if it doesn't improve, or you feel weak, severely sore, nauseated, or unusually fatigued, get checked. This is the one most people never notice, because it disappears when you flush. But it shouldn't. One-off froth, especially first thing in the morning, can just be the force of your stream. But persistent foam over several days, the kind that stays after flushing, can mean protein is leaking into your urine. That usually indicates your kidneys are straining. Imagine your kidneys as a filter in a water pitcher. It's designed to hold back proteins and blood cells while letting water and waste through. When the filter wears out, things that should stay behind leak through. Persistent foam is often the first sign. A study published in Kidney International followed 4,000 adults over 60 for 8 years and found that persistent proteinuria, protein in urine, was an early indicator of declining kidney function before any other symptoms appeared. Most had no idea their kidneys were working harder than they should. This isn't an emergency, but don't ignore it. Get an early morning sample and have your doctor check it. It's a simple test. Just don't ignore a change that persists more than a few days. Blood should stay inside your blood vessels. If you see red or pink urine, something is leaking. This doesn't automatically mean cancer. It usually isn't. It can be infection, kidney stones, prostate issues, or vigorous exercise. A study published in the Journal of Urology followed over 13,000 adults with asymptomatic hematuria and found that about 5% had underlying malignancy. That's 1 in 20 people with this finding having cancer. In most cases, early detection made all the difference. Book an appointment. Not in 3 months. Not a wait and see. Book it now. This is the one color change where waiting is the wrong choice. Calvin didn't feel sick. He felt completely fine. That's the part that matters. He didn't wait because he felt bad. He went in because he noticed something, and his wife made him act on it. That single choice changed everything for him. His wife made him take seriously something he wanted to dismiss. That decision saved his life. I want to ask you something directly. Have you ever noticed something in your urine, felt completely fine, and decided it was probably nothing? If that's you, put yes in the comments right now. Not because I'm collecting data, but because saying it out loud, even in a comment, is the first step to changing it. I read every single one. Working with patients on exactly this issue, I put together something I call the color clarity system. Think of it as a traffic light in your mind. Red light, red or pink urine, means stop and call immediately. Yellow light, dark brown, cloudy with symptoms, means slow down, assess, and act today. Green light, pale to medium yellow, clear, no symptoms, means you're in range. 3 colors, 3 decisions. That's the entire system. Every time you notice something different, run through that traffic light. You're not diagnosing yourself. You're simply deciding, is this something that needs attention today, or something I monitor and mention to my doctor? Here's what I want you to do, starting today. Just 3 things. First, look. Every time you use the bathroom, take 3 seconds. You're not obsessing, you're observing. This habit catches everything else. Second, note it. If something looks different, write down the date. One line in your notes app. If it persists, that timeline is the first thing your doctor asks for. Third, act on red. If you see red or pink urine, do not negotiate with yourself about whether it's serious. Book the appointment that day. Calvin almost didn't, and you know how that story almost ended. Cloudy urine with burning or frequency means infection. That needs attention today. Very dark brown after hard exercise needs hydration and monitoring, but if it doesn't improve or you feel unwell, get checked. Persistent foam means your kidneys might be working harder than they should. Your doctor needs to know. And red or pink urine means you need medical attention because you're being smart about early detection. Here's what I promised. By the end of this video, you'd know exactly what's harmless and what demands attention. You do now. You now have something most people your age will never have, a clear system for distinguishing between what is cosmetic and what is medical. You have permission to act without feeling like you're overreacting. You have knowledge that early detection is one of the most powerful tools you have for protecting your health. Most people around you will see changes and dismiss them. Most will convince themselves it's nothing. Most will wait. You're not going to do that anymore. You're going to look. You're going to notice. And when something is genuinely different, you're going to act. That's not paranoia. That's wisdom. Share this video with someone over 60 who might be ignoring signals from their body. Tell them you just learned something that you didn't know before. This is how we catch things early. Subscribe to The Healthy Habit and turn on notifications for dozens more videos about your blood pressure, sleep, digestion, heart, all the daily signals your body sends that most people ignore. Here's my final question. What's the one change you've noticed in your urine that you've been silently dismissing? Put it in the comments. Acknowledging it is the first step to taking it seriously. Calvin looked down one morning and noticed something. His wife made him act on it. That's the entire story. You just watched it. Now you know what to do with what you see. Small habits, done consistently, are the most powerful medicine your body will ever receive. I'm Dr. Gerald Mark. Build one healthy habit today, and I'll see you in the next one. Everything I have shared today is for general informational purposes only, based on published research and clinical observation. It is not a personal diagnosis, and it is not a substitute for care from your own doctor. Please consult your physician or a qualified healthcare provider before making any changes to your medications, diet, supplements, or health routine.